In December of 2020, I went in for a routine mammogram. I'm perfectly healthy. I have had no other health issues in my life. There's no family history of breast cancer. I was stunned to then get a call back saying that I needed to go back in for additional imaging. I had to then go in for a biopsy and an MRI-guided biopsy, only to discover that there were 3 suspicious areas which they labeled DCIS. My name is Holly Miller. I live in Virginia, just outside the Washington, D.C. area. I am 50 years old. Most of all, I like hanging out with family, especially with my daughter. After I learned that I had breast cancer, I was very, very afraid, mainly because I didn't want my family to see me go through this, especially my 12-year-old daughter at the time. So in April of 2021, I had the mastectomy on the right side as well as a full reconstruction. Went home that day and felt fairly fine considering everything my body had gone through. So it was a bit of a second surprise to get the phone call from Dr. Willie that when they had done the mastectomy, they had taken the material and done pathology on it and realized that I had invasive cancer. Dr. Willie was great in telling me some of the latest procedures, including this new procedure called Magtrace.
We first started using Magtrace for delayed sentinel node biopsy about a year and a half ago here at Inova. And I was very excited about this technology because this has been a conundrum for our patients for many, many years. I'm Shauna Willie and I am a breast surgeon. I've been a breast surgeon for over 30 years. I'm currently employed at the Inova Cancer Institute, which is part of the Inova Health System in Fairfax, Virginia. About 20 years ago, I started doing a lot of nipple-sparing mastectomies, and we were doing a lot of risk-reducing mastectomies, and we didn't know whether we needed to take out sentinel lymph nodes or not. The reason you want to avoid taking out sentinel lymph nodes is because there is an associated risk of lymphedema. Right now we are using Magtrace for patients who are having a mastectomy and have ductal carcinoma in situ. By using Magtrace and injecting it at the time of their mastectomy, we can actually wait until we get the final pathology back. Our pathologist can tell us whether or not there's an invasive cancer, and if there is, we can go back and take that lymph node out because we know exactly where it is by having injected the Magtrace at the time of mastectomy. So Holly is in this relatively small group of patients who actually had to go back to the operating room to have a lymph node removed. When we got her final pathology back, we did find out that she had invasive cancer. And in that setting, the standard of care is to go back and take out a lymph node to make sure that there's no spread of cancer to the lymph node. There's a much larger group of patients who have avoided having to have any lymph nodes removed because we were able to use the Magtrace as essentially a placeholder to be able to tell us where their sentinel node would be if we needed to take it out in the future.
When Dr. Willie offered me the Magtrace option and then of course told me the results afterwards, I was relieved beyond words just to know in real terms that the cancer had not spread, which was a big relief to me, truly life-changing.
Our initial experience with using Magtrace, our first 40 patients that we used Magtrace in, and we found that of the 40 patients who had mastectomies for ductal carcinoma in situ, 37 patients avoided having their lymph nodes removed and avoided that 4 to 7% risk of having lymphedema. I do believe that eventually, given enough time and disbursement of this information and the technology, that a delayed sentinel node biopsy will become a standard, partially because it will be driven by patients who really know about lymphedema and really want to avoid lymphedema, and also because it makes sense to surgeons to say, why take out something that we don't absolutely know we have to remove?
I have really an active life. I'm back to swimming, playing tennis, playing pickleball, with my daughter, and just happy and healthy and so relieved that the cancer is gone and that I was able to beat it. It's such an easy procedure from the patient side of view. It doesn't hurt, it leaves no marks, but best of all, it gives you concrete results. You know right away whether or not the cancer has made it into the lymph nodes or not. I hope that if there are other patients out there hearing this, that they ask their doctor about it. Say the word Magtrace and see what your doctor has to say, because it really is such a simple solution and has been life-changing for me.